Have you ever heard about magnetic therapy? Disclaimer. This video does not sponsor or promote you to try magnetic therapy since it is a pseudoscience. Pseudoscience is a group of beliefs or practices that are proved with the lack of scientific methods. So if you are seeing your parents or grandparents ordering this kind of things, then it is a hoax and there's a scientific reason behind it. But first, we need to understand why some of the people think that magnetic therapy is health beneficial, although it's not. Magnetic therapy is believed to be a medical treatment that can improve blood circulation or relieve pain in human body by hovering a static magnet onto the skin. The very basic reason that some of the people think this works is because they assume that all of the iron is magnetic. And so the iron inside the hemoglobin or the red blood cell is also magnetic, and so therefore it is attracted to the static magnet, which boosts the blood flow. However, the iron atom inside the hemoglobin is not ferromagnetic, meaning that it neither forms a permanent magnetic field nor being attracted by a magnet. Instead, they are called paramagnetic. Just like the word paralysis, paramagnetic defines the inability to generate a magnetic field. Therefore, if you are using a magnetic bracelet or a static magnet, which fall within 50 to 100 Gauss, or even if you are in an MRI machine of 30,000 Gauss, your blood flow is still in a good shape. This is because the iron atom inside the hemoglobin is not an elemental iron. Elemental iron has electrons on the outer shell that can dislocate and therefore can be attracted to a magnet. In the meantime, the electrons within the iron atom in the blood are all paired up with oxygen atoms. Therefore, they are no longer magnetic. Another thing is that magnetic therapy does not similar to the TMS or transcranial magnetic stimulation therapy, which is used to treat depression. TMS therapy introduced magnetic pulses onto a specific part of the brain to promote the neurotransmissions. Based on Faraday's law, this is scientifically correct because current can be induced when a magnetic field interacts with electrically conductive substances such as our brain and nerves. Although it has been approved by FDA in 2008, there still requires more testing for the side effects. And lastly, remember that FDA approved the TMS therapy, not the magnetic therapy. Even a 30,000 Gauss MRI machine cannot change your blood flow, so are you still willing to buy a 40 euros magnetic bracelet?